The HITECH Act. We've all been hearing about it, and every day it seems like there's new detail coming out, new blogs discussing it, and a whole lot of conflicting information floating around, making it hard to know what's fact and what's speculation. Part of the problem is that while there's a fair amount of facts in the Act itself, the implementation is still being designed, and there are lots of caveats that you need to be aware of if you're going to get the most out of it. So when it comes to an explanation of the Medicare-related incentives themselves, let's sort through the clutter and dig out the nuggets that you'll need to understand. The Act was signed into law on February 17, 2009 as part of the American Recovery and Reinvestment Act. The main goal of the Act is to encourage the adoption of electronic health records, or EHRs, through incentive payments to physicians and hospitals. Overall, the estimated cost for implementing the HITECH Act is $19.2 billion. From that, roughly $2 billion is reserved for developing the infrastructure and programs needed to increase EHR adoption, leaving $17.2 billion toward the funding of the incentives listed in the Act. That's a lot of money. So let's focus on the physician incentives listed in the Act. The lion's share is based on reimbursing physicians who have adopted EHR systems an amount equal to 75% of Medicare's allowable charges for covered services furnished by the physician in a year. And these payments will be made for a total of not 1, not 2, but 5 years beginning in 2011. Oh, and it's not yet known if those payments are going to be made in the form of a single consolidated payment or periodic installments. So if you have $100,000 in Medicare allowable charges for covered services each year, that means that 75% of that amount is $75,000. Then multiply that times 5 years, and you get a total of $375,000 in incentives. Right? Wrong. Makes sense? Of course not, because there's more to it. We haven't yet discussed the fact that every year of participation will have a cap on those incentive payments, and a de-escalating cap at that. They begin in year 1 at $15,000 and go all the way down to $2,000 in year 5. Add that up and you'd potentially qualify for $41,000 over the 5-year period, right? Maybe. That's because the government's running an early bird special for those who jump on board right away and qualify for their first payment year in 2011 or 2012. If your first year of eligible payment is one of those years, then the incentive is raised in that year by $3,000 from $15,000 to $18,000, raising the potential to $44,000 per physician over the 5-year period. And with all these figures, there's a 10% bonus for those who are predominantly practicing in recognized health professional shortage areas. Let's pause for a recap. The first year for eligible payments is 2011, and the timing of those payments is not yet determined. It may be done in a single consolidated payment, and it may be through periodic installments. The incentives are based on 75% of the eligible physician's Medicare allowable charges for covered services in the year, with a de-escalating cap assigned each year. A physician may participate in the incentive program for up to 5 years, and the first year's incentive may be as high as $15,000, or if the first payment year is 2011 or 2012, it could be as high as $18,000. The maximum potential incentive over the course of the 5 years is $44,000 or $48,400 if the physician practices predominantly in a recognized health professional shortage area. But wait, there's more. Just because you have an EHR system doesn't mean that you automatically qualify for the Medicare incentives. There are, in fact, some eligibility rules. The government believes that hospital-based physicians who substantially furnish their services in a hospital setting, such as anesthesiologist or pathologist, will already be utilizing EHR systems that the hospitals are expected to put in place with the incentives that they're receiving. So, this group of physicians are not eligible. Then there's the issue of meaningful use, and there's much discussion about that topic these days, at least in part because the details are not yet finalized. Essentially, meaningful use refers to a practice's ability to demonstrate that they're utilizing an EHR system in a manner that meets certain standards. The HIT Policy Committee released a few versions of a matrix that outlines what's still a work in progress, but identifies meaningful use objectives that are phased in over time, beginning in 2011 and becoming more demanding in 2013 and again in 2015. A final draft is expected prior to the end of 2009. Another thing is that the selected EHR system must be a certified system. Certified, that is, that it's capable of meeting the meaningful use criteria once that criteria is established. It's not yet determined who will be doing the certification, or if it will be one entity, such as the Certification Commission for Healthcare Information Technology, commonly known as CCHIT, or by several organizations. But however it's accomplished, it's the government's way of having a reasonable assurance that they're only paying out incentive dollars to those providers who have adopted systems that meet whatever the required standards end up being. Lastly, if you're planning on participating in the Medicaid incentive program, then you can't participate in the Medicare incentives because you can't do both. It's got to be one or the other. And speaking of eligibility, incentives for participation in the Physician Quality Reporting Initiative, or PQRI, may run concurrent with the HITECH Act's incentives, but incentives for electronic prescribing, or e-scribing, cannot. Like the saying goes, all good things come to an end, and the HITECH Act's incentives are no exception. What's more, this window of opportunity is relatively brief because the law states that there will be no payments made after 2016, and there will be no payments to anyone whose first year of meaningful use is 2015 or after. So let's do the math. If there are no payments made after 2016, then 2016, take away 5 years of participation, is 2011. Now, there's still some fuzzy details when it comes to the timing on some of these things, like when payments are issued in relation to the period of demonstrated meaningful use, but it's probably safe to say that if you're not able to demonstrate meaningful use by the beginning of 2011, then you're likely going to have a diminished chance to capture the full 5 years' worth of incentive payments. Basically, look at it like this. To qualify for the full amount of incentives, you'll need to be concerned with speccing, implementing, and learning your system no later than 2010 so that you're up and running and able to demonstrate meaningful use by the following year. So now that we understand the positive incentives and the fact that we must act quickly if we want to obtain them, let's talk about the flip side, penalties. In 2015, those physicians who have chosen inaction or who have failed to demonstrate meaningful use of their adopted systems will see their Medicare fee schedule reduced by 1%. In 2016, it'll be reduced by 2%, and in 2017 by 3%. In 2018 and thereafter, if it's determined that there are fewer than 75% of eligible physicians who are meaningful use EHR users, then the reductions to Medicare fee schedules will continue by 1 additional percentage point each year, but not by more than 5% overall. So let's do another round of recaps. Regarding eligibility, hospital-based physicians are excluded from the Medicare incentive program, and only systems that are certified may be used. You can't participate in both the Medicare and Medicaid incentive programs. It's got to be one or the other. Meaningful use will need to be demonstrated, and the standards for this will increase over time. Beginning in 2015, those not demonstrating meaningful use or not using an EHR at all will see their Medicare fee schedule reduced by 1%, and this could grow to as much as 5% by 2018. PQRI incentives can parallel the Medicare HITECH Act incentives, but e-scribing cannot. So, is it time to get rid of all the paper and to stop all the scribbling? There's been extensive research done that demonstrates utilizing an EHR system helps to improve patient care, increase patient safety, and simplify compliance in this nation's healthcare system. The takeaway from this presentation is this: don't wait, because a well-planned EHR implementation may take as much as a year, and EHR companies with certified systems are likely going to experience considerable backlogs. So if you've ever thought about migrating to an EHR system, now is the best time to do it if you're going to be ready to qualify for incentives in 2011 and the full 5-year bonus. Don't miss this window of opportunity and take full advantage of the many benefits of going digital. If you'd like to learn more about introducing an EHR system into your practice, about some other topic, or about the Fox Group in general, give us a call, drop us an email, or come visit us on the web. The Fox Group, providing excellence to the healthcare community since 1989.